Hi everyone, I'm Dr. Akhila, consultant fertility specialist to the Hospital Banjara Hills, Hyderabad. Today we are going to talk about the role of hormone HCG in pregnancy. HCG is human chorionic gonadotropin hormone, and it is secreted in pregnancy, which helps in thickening the endometrial lining. It helps in implantation. It supports the pregnancy, maintains the progesterone levels, and therefore prevents menstruation. This hormone is actually a glycoprotein, and it has two subunits, alpha and beta. And this hormone is secreted in early pregnancy, which has a diagnostic value, and the various clinical aspects related to HCG of clinical importance is that once we know that the pregnancy is established in the blood test, we proceed to do in the urine test, we proceed to do a blood test, and we measure the serum beta HCG levels. Once the serum beta HCG levels are established, we try to look for their doubling in 48 hours. If the levels double, then we consider it as a good ongoing pregnancy. If levels do not double or they plateau, then there is a question about whether is it an ectopic or is it a failing pregnancy. Some of the cancers are also diagnosed because of this hormone. The levels are found in the blood. Um, these are the various uses of the HCG that we know. Normally, this HCG stimulates the corpus luteum, and therefore it further secretes the progesterone hormone. This is how the action of HCG takes place. Once this HCG, it keeps on increasing till about 10 weeks, and by about 10 to 12 weeks the level lowers down and it maintains itself till the end of pregnancy. After about maybe a week to 3 or 4 weeks time after delivery, the levels go back to their zero standards. Um, this is there some of these uh, diagnostic tests that we do for HCG, there can be a false positive or a false negative result. So if we have a false negative result, it can sometimes it is called as a hook effect, wherein the HCG levels are so high that we are unable to measure it. The complexes that we measure in the HCG test are lost. So what we need to do is dilute the sample and redo the test. Sometimes there can be a false positive result, which is very rare, but this can be in conditions of cancers when certain medicines are being used. We can get a false positive result. This is all about HCG and its clinical significance in pregnancy. Any questions, please? So this HCG, it's a trigger injection that you have taken, which helps in rupture of the follicle because it's an analog of the LH hormone that we have. LH normally allows for a spontaneous rupture of the follicle. We try to induce it artificially by giving this HCG injection. Yes, if your endometrial lining is good, the follicle was a good follicle about 18 to 20 mm, you have a very good chance of conception in this cycle provided the tubes are patent. There is no way that you can increase your HCG levels. The body automatically secretes it. Like I mentioned, there is a syncytial trophoblast which eventually forms into the placenta. The syncytial trophoblast, a part of the embryo, secretes this HCG, and this hormone normally increases by itself, that's when we get to do the test, and that's when we assess and establish a pregnancy. So soon after the HCG injection, it takes about 36 to 40 hours for the follicle to rupture. So technically, you may rupture your egg if you've taken the injection today, day after tomorrow. So intercourse is recommended for the next 3 or 4 days. If scan is not available, if scan is available, we can check in the scan and see when the rupture has taken place. And the pregnancy test needs to be done about 2 weeks later. So I guess we did this question just now. Next question, please. Of course, you can have a healthy baby with hormonal imbalance. There is no problem with that. What is the imbalance we need to check and how to correct the imbalance? Pregnancy is not just about whether the estrogen and the progesterone levels are normal or not. It is not just about the levels being normal. Again, the levels need to escalate according to what we expect. That happens only when the egg is growing. Once the egg grows, the estrogen increases. Once the follicle is of a particular size, it ruptures when the LH increases, and that's when the progesterone also starts to increase. That's when the estrogen falls a bit, the LH also falls. So there is a cycle that is maintained. It is not just normal levels. They have to maintain this periodicity that we expect. So that happens only when an egg is growing, and this growing egg, this increase in progesterone grows the endometrial lining of the uterus. So all these are important for a pregnancy to occur naturally. And not only are the hormone levels that are important, the tubes also need to be patent. That's when we can think that a pregnancy can occur naturally, the chance of which is about maybe 3% every month if the intercourse is unprotected. HCG injections. It depends on what kind of a pregnancy it is. If it is a natural pregnancy, we don't really require any of the injections. If it is an IUI or a OITI cycle or an IVF cycle, nowadays we supplement progesterone injections, which are enough. If HCG needs to be added, because HCG anyway gets converted to progesterone, if HCG needs to be added, we add it till about 10 to 12 weeks. 10 weeks is also. It depends totally on how many follicles have grown in an induction cycle or how many embryos have been put inside. That is what determines twins, not the HCG injection alone. Thank you very much.